Hi guys, my name is Madeline Trant and I'm here to talk to you about Molluscum Contagiosum, which is a sexually transmitted infection. This infection is caused by a pox virus affecting the top layer of the skin, also known as the epidermis. The result of this infection is usually a benign, mild skin disease characterized by lesions or growths that may appear anywhere on the body, including the face, neck, arms, abdomen, and genital areas. Symptoms seen with this virus are lesions that are small, raised, usually white, pink, flesh-colored, with a dimple or pit in the center. It has a pearly appearance that is usually smooth and firm. The size of these lesions can range anywhere between a pinhead or as large as a pencil eraser, which is between 2 to 5 millimeters in diameter, and it could also be by itself, alone, or in groups. There are several treatments available, physical, oral, or topical. Physical treatments include cryotherapy, which is freezing the lesion with liquid nitrogen, curettage, which is piercing the core and scraping the cheesy casing material inside it, or laser therapy. An oral treatment to it would be more desirable for pediatric patients because it is less painful and it can be administered by your parents at home in a less threatening environment. The downside for oral treatments is that it is less effective for facial lesions. Topical treatments include medications such as iodine, salicylic acid, potassium hydroxide, and Micamod. Also, podophyllitoxin, which is a cream, a 0.5% cream. However, it's not recommended for pregnant women, and for this cream, it treats individual lesions rather than group lesions. Some statistic about these patients between the Molluscum Contagiosum virus 1 and virus 2 was studied. In a study of 147 patients, Molluscum Contagiosum virus number 1 was the cause of 96.6% of infections versus the virus 2, which caused about 3.4% of the infections. This common infection is common throughout the whole entire United States and accounts for approximately 1% of all disorder diagnosed, compared to, say, acne and everything else. The prevalence rate of this is higher in HIV patients, the autocompromised, and it is reported between 5 and 18%. If the patient with HIV has a CD4 cell count that is less than 100 cells per microliter, the prevalence of this virus is reported even higher, over double, at 33%. During regional outbreaks throughout East Africa and elsewhere in the world, in East Africa, it's estimated that 17% of the village population was infected, and as much as 52% of children older than the age of 2 has developed these lesions. Nationwide, at least 2 to 10% overall of children are diagnosed annually, making this affecting more children than adults.